Hello, and welcome to the Selection of Sampling Data webinar. This webinar is part of ATSDR's Public Health Assessment, also called PHA, webinars training series. The content covered in this webinar is based on Module 5 of the online PHA training. This webinar is sponsored by the Agency for Toxic Substances and Disease Registry, also called ATSDR. For reference, the presentation slides I'll be using and the recording of this webinar are available on ATSDR's website. The files are available in accessible format for people with disabilities. I am David Millard, a toxicologist with ATSDR. I am the Associate Director of Science in the Office of Capacity Development and Applied Prevention Science. I have been at ATSDR for over 35 years and have conducted multiple health assessment investigations and developed health assessment guidance. Today, I am joined by James Durant from ATSDR. James, would you like to introduce yourself?
Yes, thank you. As mentioned, my name is James Durant, and I'm a certified industrial hygienist. I've been with ATSDR since 2002. I've been a health assessor and worked in exposure investigations, emergency response, and data analysis. Now I'm with the exposure investigation section in the Office of Community Health and Hazard Assessment.
This webinar is based on the content included in online PHA Training Module 5, where you learned how to select appropriate sampling data and ways to identify and fill data gaps. Module 5 focuses on several expectations, including how to define what sampling data are appropriate, identify factors that affect data quality, select the sampling data that are appropriate for use in the PHA process, define what a data gap is and how to address it, and finally, determine if the sampling data for example sites, such as the Gala Lumber Company, are appropriate. You'll hear us refer to the Gala Lumber Company as the GLC Case Study Site, or GLC site for short. So why is it important to select appropriate sampling data? As part of the PHA process, you will need appropriate environmental data to effectively evaluate the health impact of people's exposure to contaminants. Biological data, such as blood lead data, may also be available to evaluate exposure. The environmental and biological data could indicate vital information needed to evaluate the exposure pathways and health effects, such as the kind and levels of contaminants people may be exposed to, when and where contaminants were found, and how widespread contamination is. The bottom line is that selection of the sampling data is critical to being able to understand the levels at which people are exposed in identified potential and completed exposure pathways, and if there are any critical data gaps in our understanding of these exposures. During the PHA process, you can learn about site-specific exposure pathways through site visit information, community concerns and information, discussions with the site project manager, and review of site reports. You will also use the information you collect to help evaluate the representativeness and quality of the sampling data. You will need to understand the general concepts of exposure units and sampling designs, as well as differences between discrete and non-discrete data. Other important concepts to understand are the differences between critical and non-critical data gaps. Also, in some cases, there may be unique features of the data needed to appropriately screen contaminants, to calculate a reasonable exposure point concentration, or what we call an EPC, and to conduct an in-depth tox evaluation, which are covered in later PHA training modules. Let's go over the objectives for this webinar. We will provide context on how the selection of sampling data is informed by the first steps of the PHA process. understand how the selection of sampling data relates to the rest of the PHA process. As mentioned in the previous webinar, we teach the PHA evaluation approach as a sequential process, but it's really an iterative process where health assessors are constantly looking backwards to the data and pathways analysis and looking forward to the ultimate goal of determining if exposures may have caused harmful health effects. We also will provide you with several examples of various media data sets to determine if they are representative of exposures. We will use the medium-specific environmental issues handouts from Module 5 to review questions you should ask yourself when reviewing various data sets. We will use some data sets from the GLC case study site and some from real sites. We will bring up a few questions to see how you evaluated the representativeness of some of these data sets. And we will discuss data gaps and how to identify critical gaps, then provide an example of the use of modeling to attempt to fill a critical data gap at a site that I worked on. And then finally, we will discuss each data quality objective, or DQO, and data quality assessment, or DQA, and how to use them in the PHA process. There is no single approach to evaluate data appropriateness. The level and extent of data review needed often varies from site to site. However, there are some fundamental steps that apply to most data evaluation efforts. First, learning about the site will help you better understand how people might come into contact with contaminated media. This is important because to evaluate exposure, you need sampling data that reflect contamination in the environmental media that people can come into contact with. Second, data representativeness refers to the degree the data are sufficient to identify the concentrations and locations of contaminants that are available for potentially exposed populations to interact with. Data representativeness also refers to how well the data characterize the time period when exposures occurred for a specific pathway. And this could be an important, especially for the air pathway. And third, consider the quality of the sampling data. Environmental data are considered appropriate for the PHA process when they are of sufficient quality and quantity to conduct the exposure and health effects evaluation, as well as being representative of site and environmental conditions. It's important to note there are no perfect data sets, but this module provides you guidance and tools to gauge whether we can make a health determination based on the available environmental data sets that are presented to us. It is important to document the limitations and uncertainties of the environmental data that go into making a health determination. Now let's look at several concepts before we go any further. First, what is discrete sampling and how does it relate to evaluating the appropriateness of sampling data? A discrete sample is an individual environmental sample from a given point in time and is independent of other samples. Sometimes this is referred to as a grab sample. If you do not have a sufficient number of discrete samples, a minimum of 8, then you will not be able to calculate a reasonable 95% upper confidence limit of the mean, and you will be forced to use the maximum concentration, do modeling, or ask for more samples. Using the maximum concentration will introduce more uncertainty, or requesting more samples will likely delay your evaluation of the pathway. If you use the maximum concentration to estimate exposure, Remember to carry this uncertainty into your decision about whether or not health effects are possible. Now let's discuss what non-discrete sampling is and how it relates to evaluating the appropriateness of sampling data. Depending upon the sample design, non-discrete sampling refers to composite sampling or to incremental sampling methodology, or what they call ISM. Composite sampling involves combining usually 6 or more discrete environmental samples for a single analysis. An ISM sample is a structured form of this composite sampling. ISM samples are designed to characterize the overall contaminant levels within an area of interest using a predetermined grid and sample location. The grid consists of numerous discrete soil samples, usually 30 or more, that are collected and combined to form a single ISM sample for laboratory analysis and processing. ATSDR's non-discrete sampling guidance provides more information on the number of samples related to ISM. ISM data may not tell you much about hotspots, which limits evaluating acute exposures. But it's considered to be the most statistically sound approach to evaluate longer-term exposures. Composite sampling is used for various media, such as soil and fish, and sometimes surface water. The ISM method is most often used for soil, but has also been applied to sediment. And finally, what is the concept of an exposure unit and why is it important? An exposure unit is also called an area of exposure or exposure area. An exposure unit is the location and time where people could interact with contaminants in soil, water, air, or food. It's part of an exposure pathway evaluation and is a person's point of contact with contamination in a specific environmental media. The general assumption is that all points and times within an exposure unit contribute equally to a person's or group's exposure. People are assumed to move throughout an exposure unit such that average concentrations within the area characterize long-term exposures. If this is not the case, then health assessors should consider defining smaller exposure units. ATSDR has a guidance document on this topic called Identifying Exposure Units for the PHA Process. The document is on ATSDR's website on the resource page in our Public Health Assessment Guidance Manual, which we call FAGM. We will cover this topic in more detail in the PHA training webinar on exposure point concentrations and exposure units. So be sure to watch that for more information. There are many considerations when defining an exposure unit, such as they can vary by size, they can vary by the conditions of exposure, like accessibility. They are defined by people's activities, and sites may have multiple exposure units. There are many sources of information to use when defining an exposure unit. Examples include conceptual site models, exposure pathways analyses, maps, photographs, physical barriers, and institutional controls. Some examples of exposure units include residential yards when neighborhood soils are contaminated, private wells used by households, and the playground at a school. Now we will discuss types of potential data gaps that you might identify as part of the health assessment process. For example, data were not obtained and analyzed using appropriate methods. Data do not include all media that could be impacted. Data do not include the potential contaminants of concern. And finally, the amount of data was not sufficient sufficient to characterize exposure. Other examples include data were not available in all areas of the site, data were not taken over time, or data collected in the past may not represent current conditions. Another important concept to understand is critical versus non-critical data gaps. A critical data gap is when the lack of information prevents us from reaching a public health conclusion, and therefore represents a data gap that should be highlighted in your documents. A non-critical data gap is where the lack of information is not essential for reaching a public health conclusion. We define a data gap as critical or non-critical, mostly in relation to our understanding of the exposure point concentration in a potential or completed exposure pathway. However, data can also be important for understanding an element of an exposure pathway, but not necessarily in relation to actual exposures. For example, if you have groundwater contaminant data from monitoring wells that are located between a source and private wells, these don't represent actual exposure data, but they are important for understanding whether groundwater contamination is present and might be migrating towards private wells. Any decisions about possible health effects using monitoring data instead of private well data will have some degree of uncertainty that should be discussed in the public health assessment documents. Now let's look at several examples of site data from the GLC site and from some real sites to review whether the data are appropriate for use and to determine if there is a critical data gap. Let's look at the various data relating to some of the completed exposure pathways associated with the GLC case study. First, we will evaluate the representativeness of the data for the soil pathway, both on-site and off-site exposure. The map shows here is the southwest quadrant of the GLC site. It shows sampling locations around the drip pad and associated sampling identifications. And it represents site conditions in August of 2015, where a daycare facility has been placed just off-site to the southeast of the drip pad. We know that after lumber was treated with chromated copper arsenate, or CCA, at the GLC site, the lumber was placed on an uncovered drip pad. The CCA dripped from the lumber onto the pad and contaminated the soil in this area. Workers have access to this area, so this is a completed exposure pathway for the past and current. According to the site report in the online training, trespassers used to access the site, but it was fenced in 1992. So when trespassers had access to this area in the past, this would be considered a completed exposure pathway. And workers currently at the facility may still be exposed, which is also considered a completed pathway. As shown on the map, on-site soil sampling was conducted at the drip pad area with 19 discrete samples analyzed. This slide presents the table with surface soil sampling results for the GLC on-site drip pad area in Operable Unit 2. The table shows the sample location, sample description, date, along with levels of arsenics, hexavalent chromium, and copper in milligrams per kilogram. These are all chemicals associated with using CCA for the treatment of wood. Let's examine the representativeness of the on-site surface soil data by answering several questions. First, Do sampling results characterize contamination in soils from areas with different land uses? To answer this question, we will need to determine whether areas were accessible to workers and trespassers now and in the past. Also, these data only represent the contaminants that are most likely present based on past activities in this area. Many times, we do not know with certainty what was disposed of at a site. So we need to make sure that a full range of contaminants are analyzed to adequately characterize site contamination and potential exposures. We can say the data are representative if we are confident that no other processes occurred in this area that might have contributed to contamination. Second, can you match up the sampling locations to determine if they are in accessible areas? The answer is yes. You can compare the sample numbers with the areas accessible to workers and trespassers in the past and currently. This information can be obtained by reviewing maps, when you do a site visit, or from other methods such as talking to EPA staff or the community. The third question is, are soil samples discrete or composite samples? The answer is these are discrete samples, and we have more than 8 samples. However, the number of samples to consider may be different for each exposure area that you determine was accessible to workers or trespassers. The fourth question is, at what depths were soils sampled? The answer is soil samples less than 3 inches deep are considered by ATSDR to be surface soil, and soil deeper than 3 inches is considered to be subsurface soil. The information provided indicates that the depth of the sampling is 0 to 6 inches. These data can be used in the PHA process, but as mentioned, 0 to 3 inches is preferable for surface soil. If these were 0 to 12 inches or deeper samples, they may not be representative of workers or trespassers' exposures in this scenario and should not be used to make a definitive health determination. They could be useful, though, for evaluating worker exposures depending on the intensity of on-site activities, such as workers who are known to dig or excavate the soil as part of their work duties. Question 5 is, were in vivo bioavailability or in vitro bioaccessibility tests conducted for metals? You should ask if there was any site-specific bioavailability testing for arsenic, because it is an exception to ATSDR's assumption of 100% bioavailability. For soil arsenic, ATSDR assumes 60% as a default relative bioavailability factor, and this is automatically included in the dose calculator in ATSDR's Public Health Assessment Site Tool, or FAST. The default relative bioavailability for arsenic can be changed if site-specific bioavailability or bioaccessibility information is available. Now we will ask the 6th question. Have there been any soil removal activities, such as excavation, that occurred that may have changed contaminant levels at the surface or removed the contaminated soil altogether? For example, were the data taken before a removal action so the soil is no longer found at the site? The answer is soil is still contaminated. Actions have been taken to stop current exposures for trespassers, but contact still may be possible for on-site workers. Data should be representative of past exposures because no removal actions have been taken except to limit access to the site, which was fencing installed in 1992. Given the proximity of the daycare center to the drip pad area, it is reasonable to be concerned that the daycare soil could be contaminated with CCA, and daycare children and adults may be exposed. So now we will examine soil exposures at the nearby and off-site daycare facility. This is the same figure as before, except now it shows the locations of off-site soil samples on the daycare property. It appears that we have 18 samples, which are biased towards the area between the drip pad and the daycare center. This would be considered a good bias because we would expect that this is the most likely area to be contaminated from the on-site activities at the drip pad. There are also 6 other samples taken in different parts of the daycare facility property that are not adjacent to the drip pad. This slide shows a table with the surface soil sampling data collected at the off-site daycare center, which is next to the former on-site drip pad area. Remember, the 2 areas are separated by a fence. The table shows the sample location, date, and concentrations of arsenic, hexavalent chromium, and copper in parts per million. Before we go any further, let's ask ourselves, are these off-site soil sampling data representative of exposures at the daycare? Before I provide you my response, let's go through the same questions again. First, do sampling results characterize contamination in soils in the playground areas of the daycare? You need to identify the boundaries of the new exposure unit involving the daycare and determine which areas are accessible to children. And as with the on-site soils, figure out if there are other contaminants or other activities that occurred in the drip pad area. We want to look and see if there was a full range of contaminants analyzed in the off-site soils. We can proceed if we feel confident that no other processes occurred in this area. Second, can you match up the sampling locations on the map with the data reported in the table and determine if the samples are in areas accessible to children and staff from the daycare? Similar to the first question, you should be able to determine this from your site visit and from knowledge of the sampling locations reported in on-site maps. Using Google Earth also might provide some additional insight about the sample locations and exposure units. Third, are the soil samples discrete or composite? These are the same as the on-site data, which are discrete samples. And if you have at least 8 randomly collected samples in the exposure unit, you should be able to calculate a reasonable exposure point concentration, or EPC. ATSDR has 2 guidance documents explaining how to handle discrete and composite samples. These guidance documents are named ATSDR's Discrete Sampling Guidance and ATSDR's Non-Discrete Sampling Guidance. You can find these documents on the FAGM resource page, which can be accessed through atsdr.cdc.gov. Fourth, at what depths were the soils sampled? Well, the table doesn't provide sampling depth, but as we just talked about, the sample depth for the on-site soils was 0 to 6 inches, which can be used to evaluate human exposure with contact to contaminants in surface soil. If these were 0 to 12 inches or deeper samples, the sample results might not be representative. of children and daycare workers, exposures to soil contaminants at the surface. Fifth, were in vivo bioavailability or in vitro bioaccessibility tests conducted for metals. You should ask if there is specific bioavailability or bioaccessibility testing for arsenic. The results of these tests are used to calculate the relative bioavailability of metals. If these tests are not available, we assume 60% relative bioavailability as the default for arsenic. As I mentioned before, this is an exception to ATSDR's assumption of 100% bioavailability for metals. 6, have any removal activities occurred that have changed soil contaminant levels? There's been no activities or removals at this daycare facility, so the answer is no. It's also important to note one other item. We have hexavalent chromium levels reported from on-site soil samples. And we need to determine if off-site chromium results are reported as total chromium or hexavalent chromium. As shown in the previous slide, we have hexavalent chromium levels in off-site soil samples too. Now getting back to the questions I asked earlier, which is, are these off-site soil sampling data representative of exposure at the daycare? I would say the answer is maybe, as you will need to find out more information about which samples are in accessible areas and what are their sample depths. Now let's look at another pathway and evaluate the representativeness of on-site and off-site sampling data for the groundwater pathway. This figure shows the entire GLC site and highlights the direction of groundwater flow from the drip pad next to the daycare center and from the trichloroethylene or TCE spill area on the northern boundary of the site. Also, please note, and these are not shown on the slide, but there are 3 on-site monitoring wells down gradient of the TCE spill area and 1 up gradient on-site well. Monitoring wells GL1, GL2, and GL4 are down gradient, and monitoring well GL3 is up gradient and is considered background. To evaluate the groundwater exposure pathway, you should review the direction of the groundwater flow to help inform whether appropriate groundwater sampling has taken place. As shown on the map in the red box, we know that 6 private wells were sampled down gradient of the TCE spill areas. If the boundaries of the groundwater plume are adequately delineated, then maybe sampling of these 6 homes is sufficient. However, if it's not an adequately delineated plume, then you should identify as a data gap the other wells potentially down gradient or side gradient of the TCE spill. And please note that each one of these 6 homes is considered a separate exposure unit. Also, it appears that several homes potentially down gradient of the PCB dump area are located just off-site. No information is available on whether there is an on-site groundwater plume of PCBs or other contaminants. While we know that PCBs are only marginally soluble in water, there is a potential for groundwater contamination. The lack of on-site groundwater data in the PCB dump area is a data gap and makes this a potential exposure pathway if there are down gradient monitoring wells, if there were down gradient private wells. Also, other waste may have been dumped at the PCB dump area that is more soluble than PCBs, which could have contaminated the groundwater in this area. No private wells are located immediately down gradient of the drip pad area, but you will need to look further away from the site and understand if there is a plume of metals or other contaminants migrating from the drip pad area to a potentially exposed population. Now let's look at the representativeness of on-site groundwater data for the TCE spill area in the northern part of the site, which is referred to as Operable Unit 1. This table represents the first round of on-site VOC groundwater sampling from the 4 monitoring wells, with samples collected for down gradient wells GL1 and GL1 duplicate, GL2 and GL4, and the 1 upgradient well, GL3. There were also blank samples collected. Please note that the sampling data for the on-site groundwater are similar to both rounds 1 and 2, so I'm only presenting round 1. These data are in parts per billion. First, before we get into the questions, there are some things we need to know about the activities at the TCE spill area and the fate and transport of TCE and groundwater. Also, you should note that the hydrogeography can be complex, and depending on the characteristics of the pollutants, some pollutants may or may not move with groundwater flow direction. There are arrows pointing to carbon tetrachloride, cis-1,2-dichloroethylene, trichloroethylene, and vinyl chloride to bring those to your attention. First, carbon tetrachloride is present because of the degreasing activities by one of the companies that once operated on the site, which was DeLauder Metals. Thus, this is not just a TCE-related plume. And secondly, we know that TCE can break down to other chemicals as it loses chlorine atoms. Based on these data, it is apparent that TCE is completely degraded, and the breakdown products cis-1,2-dichloroethylene and vinyl chloride are what remain in the groundwater. Now let's ask ourselves some questions. We will go through questions to determine if the on-site groundwater data are representative. Note, these questions should be answered based on on-site investigation documents, the site visit, community interactions, and in coordination and consultation with environmental agencies. First, were the groundwater samples collected in the aquifer with the potential for a point of exposure? Yes, assumed to be the shallow aquifer. Second, was on-site groundwater sampled in all wells that may be sources of drinking water? We know there's no drinking water wells on-site. All on-site results come from on-site monitoring wells. Third, was the groundwater contamination plume clearly delineated? This is unsure from the data and information provided in the case study. This information will affect whether there's a critical data gap relating to the other wells down gradient from other on-site source areas. Fourth, did the sampling occur both up gradient and down gradient of the site and the TCE contaminant plume? Yes, as I mentioned before, we have 3 on-site monitoring wells that are located down gradient of the TCE spill area, and we have 1 on-site monitoring well located up gradient. If you notice in the data for GL3, the up gradient monitoring well, except for the 1 methylene chloride hit that is probably a blank contaminant, no other contaminants were detected in the up gradient monitoring well. Groundwater up gradient of the TCE spill area is likely not contaminated. Fifth, was the time frame for sampling collection adequate, and were seasonal groundwater samples taken? No, we have 2 rounds of sampling, all in the same month in 2015. The bottom line on representativeness, because there are no exposures on site, is that these data provide us some good information about the groundwater plume relating to the activities at this TCE spill area, but not necessarily with other source areas. We have no information about the groundwater contamination in the PCB dump area or the drip pad area. So these 2 areas may be critical data gaps for groundwater contamination in other parts of the site. Now let's look at the representativeness of offsite TCE data for the drinking water pathway. This table presents the results in parts per billion for private wells 3, 4, and 5. The other private wells did not have any detection of VOCs. There are arrows pointing to carbon tetrachloride, cis-1,2 dichloroethylene, trichloroethylene, and vinyl chloride to bring those to your attention. These data tell us that carbon tetrachloride and cis-1,2 dichloroethylene are present in wells. However, there are no detections of vinyl chloride or TCE. These data are relatively consistent with the on-site groundwater monitoring data. Before we go any further, let's ask another question about the representativeness of these data. The question is, are these sampling data representative of exposure to contaminated drinking water from private wells? Let's go through the questions and I'll again provide my response at the end. First question, were the groundwater samples collected in the aquifer of concern? Probably. This is the shallow aquifer. The next questions include, was the groundwater sampled in all off-site wells that may be sources of drinking water? Is the groundwater contaminant plume clearly delineated? Did the sampling occur both up gradient and down gradient at the site? And finally, were all possible groundwater contaminant plumes sampled? Maybe the groundwater was sampled in all off-site wells that could be sources of drinking water. But to really answer the question, we need to get a better understanding of the extent of the TCE plume in off-site areas, northwest of the site. To do this, we would need additional groundwater data to identify possible contamination beyond the private wells that border the northwestern boundary of the site. We also need to identify groundwater plumes in other areas, such as groundwater down gradient of the PCB dump area and down gradient of the drip pad area. Last question, was the time frame for sample collection of the TCE plume adequate? And were seasonal groundwater samples taken? Private well water samples were taken over 2 seasons in 2015. If these were the only data available, then you'd use these to evaluate the exposure pathway. However, because the groundwater samples were collected from just 1 year, this may not be indicative of chronic exposure, but this will be one of the limitations of the evaluation. For this question about time frame, I think it really depends on if you're referring to just the 6 private wells or to all private wells. For the 6 wells sampled, I would say probably yes, and maybe not for other private wells down gradient of the TCE plume area. For this case, both answers are potentially correct, depending on how you justify it. So now, before we leave these data, we can also ask a couple of questions about these data in relation to the soil vapor intrusion, or SVI pathway. First, were the wells screened across the surface of the shallowest aquifer? We've already answered that question, and that answer is yes, because the groundwater samples were from the shallow aquifer. Second, can vapor forming concentrations beneath the buildings be inferred from these data? The answer is yes. We can screen these data using ATSDR's SVI groundwater CVs. Because the groundwater CVs are exceeded, there is a potential exposure pathway for vapor intrusion, and we will need results from indoor air samples to fill a critical data gap. Because we need indoor air samples to fill a critical data gap, we do not have indoor air data to evaluate the SVI pathway for the entire GLC site. So let's look at a subset of SVI data from another site, the Gardner Manufacturing Facility in Wisconsin, which is an actual site. The primary contaminant concern here is TCE. The data in this table show air samples from 2 buildings and several residences near the facility. The data are for subslab, basement, first and second floor living areas, and outdoor air. Let's go through the questions for the SVI pathway to see if the soil gas and indoor air data are representative. For soil gas, at what depth was soil gas monitored? And were subslab soil gas samples collected from within 3 feet of the foundation? These are 2 related questions, and the answer is yes to both. The next questions are, what is the depth to contaminated groundwater? Is the plume expanding, receding, or migrating? Where are the plume boundaries? And what type of soil is between the groundwater and the surface? So first, for this site, the plume is 9 to 15 feet deep and is migrating to the northeast toward occupied buildings. And ATSDR evaluates the potential for the SVI pathway if a contaminated groundwater plume runs in subsurface soil within at least 100 feet laterally or vertically of occupied buildings such as homes. And we also know that we have a map that shows the buildings and plume boundaries with isoconcentration contours. We also know that the geology from the site is mostly stratified sand, silty sand, silt, and clay deposits. In general, the more porous the soils are beneath and within 100 foot of structures, the more likely soil gases can migrate and enter these structures. However, this is just one of many factors that affect the SVI pathway. And I will refer you to ATSDR's guidance for evaluating vapor intrusion pathways, which is available on the FAGM resource page. You may also contact ATSDR's subject matter experts for SVI through your Associate Director of Science Office or through your Technical Project Officer, which we call a TPO, if you are with Appletree. Appletree is ATSDR's name for a cooperative agreement we have with state health departments to conduct the PHA process. Now to the next question. Were soil gas samples collected to characterize potential exposures or to characterize potential explosive hazards? Samples were collected to determine the potential for TCE and its breakdown products to migrate into the indoor air of these homes and buildings. If sample results indicate a potential explosive hazard, health assessors should involve ATSDR's emergency response staff and local fire officials. Appletree staff should contact their TPO. The next question is, what gases are monitored? Do the gases monitored include those believed to be found at the greatest quantities or the most toxic? The answer is yes. TCE and its breakdown products were analyzed for, and only TCE was found. Lastly, is the monitoring continuous or periodic? These are periodic samples over several seasons. Now let's ask questions to determine if the indoor air data are representative. First, was the duration and frequency of indoor air sample collection appropriate to determine the vapor intrusion pathway for the site? The answer is yes. We have 6 sampling events over several seasons and over 2 years. Second, were the basement and main living areas or office spaces sampled? Yes, basement and both floors of the living areas were sampled. In addition, outdoor air was sampled to determine if that may be contributing to the indoor air levels. Third, were indoor sources considered? This is unknown, but this should be a routine part of any indoor air investigation. Fourth, were subslab soil gas and indoor air samples collected at the same time so they can be compared? Yes, they were. Fifth, was there a crawl space? No. 6, were samples collected during different seasons? Yes, we have sampling events in 4 different time frames and seasons in 2011 and 2 in 2012. And it's important to note that indoor air levels can vary seasonally because of various factors, such as temperature, barometric pressure, wind, air exchange rates, etc. And therefore, that's why we need sampling over many seasons. Finally, for follow-up samples collected after installing mitigation systems. This is unknown, but it's something to keep in mind for other sites. So now that you know all this about your data set, let's answer whether we think the data for the SVI pathway are considered representative. I think these data are representative for the SVI pathway and can be used to determine an EPC and evaluate the health implications of TCE exposures. As I mentioned before, although there are no perfect data sets, this one here, I believe, comes as close as you can for evaluating the SVI pathway. Because we do not have any data to evaluate the air pathway for the GLC site, I'm using an evaluation of sulfur dioxide exposures, or SO2, at a petition site in Midlothian, Texas, that ATSDR worked on. Let's go through some background information and some features on the map. All of this comes from the final 2016 health consultation, which evaluated exposures to hydrogen sulfide and to the National Ambient Air Quality Standard criteria contaminants like particulate matter and SO2. We will focus on SO2 today. The primary sources of SO2 releases from this site were from 3 cement manufacturing facilities shown on the map. TXI in the southwest corner of the map, Ash Grove in the top central north part of the map, and Wholesome in the top east part of the map. The Gerdau Ameristeel Company, tucked just north of TXI, did not release significant amounts of SO2, but released other contaminants of concern, including particulate matter and metals. We have 4 monitoring stations that operated for many years, providing continuous SO2 data in 1-minute intervals. No samplers were located near Wholesome or Ash Grove for these contaminants. But when winds were favorable from these facilities, increases in SO2 at the air monitoring locations to their south occurred. There are also 2 air monitoring locations north of Gerdau and TXI, and 2 air monitoring locations east, and southeast of those facilities. I also want to mention that it's important to know the differences between monitoring and sampling. Sampling is generally conducted for a defined location and population for a particular point in time, whereas monitoring usually refers to sampling with some periodicity, which includes continuous sampling or repeated sampling over a specified time frame. The SO2 data points together are considered monitoring data. So what were the primary and secondary wind directions? As you can see from the wind rows, the two dominant wind directions were from the south to the north and from the southeast to the northwest, with a couple of minor secondary components to other directions. And we also know that many residential dwellings are in the primary downwind direction from TXI. However, a few data gaps exist relating to the Ash Grove facility, and we have populations that are in the primary downwind direction. So we know that Ash Grove cement released as much SO2 as TXI did, but we have no monitoring data downwind of the Ash Grove facility. Wholesome did release some SO2, but not nearly as much as the Ash Grove or TXI. We would consider this lack of air monitoring data a critical data gap because we have no sampling or monitoring SO2 data for areas north of Ash Grove. We conducted air modeling. These monitoring data show us 5-minute peak intervals of SO2 sampling from 1998 to 2012 for the 3 monitoring locations downwind of TXI. The locations include Midlothian Tower, Old Fort Worth Road, and Wyatt Road. The graph also shows some of the effect levels and the acute inhalation minimal risk levels, also called an MRL. As you can see from the graph, levels of SO2 from the 2 monitoring stations decreased over the years. And we know these decreases are mostly due to the addition of treatment systems by TXI to prevent SO2 emissions. Often for an air pathway, one must understand averaging times needed to evaluate toxicological implications of exposures to determine if the data are representative of exposures of toxicological concern. For SO2, the important averaging time for comparing to the ATSDR MRL is in the 5 to 10 minute interval, because the acute MRL of 10 parts per billion is based on studies of exercising asthmatics for this duration of time. In addition, hourly SO2 data can be compared to the 75 parts per billion National Ambient Air Quality Standard, or NAAQS. This NAAQS was developed by the U.S. Environmental Protection Agency, or EPA, to protect sensitive people from these short-term spikes of 5 to 10 minutes. Understanding the toxicology of the critical effect of a chemical can help guide your evaluation of the representativeness of data for not only screening, but also for determining the EPC and for evaluating potential health effects. Now let's go through the questions to determine if the data for this air pathway are representative. First, was the duration of sample collection appropriate to describe the relevant exposures for the site? Yes. Data over many years showed SO2 levels were consistently elevated. Second, were samples obtained using appropriate methods? Yes, we have continuous 24-hour monitoring at 1-minute intervals that could then be averaged to 5 to 10 minute levels or to 1 hour levels for comparison to inhalation MRLs and to national criteria pollutant levels. Third, were samples collected at locations upwind and downwind from the source? Yes, for the TXI facility, but not for the other 2 locations that released SO2. Fourth, was a source of concern operating fully when the samples were taken? Yes, for TXI. Fifth, are stationary monitors located in areas representative of the pathways of exposure? Yes, again for TXI. 6, were the data generated for a one-time sampling event or for a long-term ambient air monitoring? As I mentioned, this is long-term air modeling for TXI. 7th, did sampling occur over a long enough period to capture seasonal variations? Yes, again, it operated on a continuous basis for many years. Thus, the bottom line is that these data are representative for TXI exposures. But again, we still have a critical data gap relating to the Ash Grove and Wholesome facilities. Before I show you what we did to fill the data gaps relating to SO2 emissions at the Ash Grove facility, let's review what modeling is and some questions that can be answered by models. Health scientists may conduct modeling to estimate the nature and extent of contamination at some sites. For instance, when relevant sampling data are not available for areas or timeframes being studied. ATSDR has also used modeling to estimate exposure and make a health determination. There are many different models and statistical tools to estimate levels of environmental contamination. Some of these are statistical tools that predict the spatial distribution of contaminants by interpolating among observed values. Also, mathematical models can simulate past or future fate and transport of environmental contaminants in various media, such as air and groundwater. Next, and finally, graphical tools can be used to illustrate trends based on statistical analysis of modeled data. I want to mention that modeling studies can be very difficult to review. If you do not have the expertise to critically review a modeling application, seek input from colleagues who are experienced with models. Health assessors often defer to experts within or affiliated with ATSDR to conduct detailed model evaluations. So here are some of the questions that can be answered by models. How far will groundwater contamination extend 10 years from now based on current conditions? How large of an area was affected by the spill or release? Where should samples be located to assess the extent of contamination? Next, what are the optimal locations for air sampling? And finally, what are the estimated exposure levels of blended public water based on the contributions of individual wells that make up the system? A health assessor can consider the use of modeling whenever environmental sampling data are inadequate to make a health determination. There are advantages and disadvantages of using models in our work. We can make a health determination using model data if it is conducted by an experienced modeler using an appropriate model and inputs, and the data and site-specific parameter information are valid. However, in some cases, the uncertainty of the model data is so great that predicted data are not suitable for use in making a health determination. On the other hand, keep in mind that limited sampling data for many sites may also suffer from the same problem. Sometimes a combination of tools will need to be used to develop multiple lines of evidence to support public health conclusions and recommendations. Okay, turning back to the Ash Grove facility, where we did not have air monitoring data associated with that facility, but we did have SO2 modeling results, which you see here, and these provided us with some evidence where exposures are not a concern. Basically, there's no population located within the 75 part per billion detection area predicted by the model. We use the 1 hour NAAQS as our comparison, and there were no exposed people, at least based on this model. However, there were limitations to the modeling, as this was based on annual emissions and not those closer to the averaging times of concern, 5 to 10 minutes. Therefore, we could not make a definitive health determination. If we had hourly emissions to inform the model, then we might have been able to make a better health determination. Luckily, Ash Grove took actions to reduce emissions and exposures. And now I will turn the discussion over to James.
Thank you, David. I'm going to switch gears a bit and talk to you about data quality assessment, or DQA, and give a broad overview of how it works within the public health assessment process. It's important to note that health assessors are generally not expected to conduct in-depth data validations. You should, however, be familiar with the terms and general methods used to validate the data, and when needed, consult with other team members, such as analytical chemists, site investigators, and the laboratory that generated the data. Talking to these folks can help you clarify any questions related to the methods used or the data validation documentation. And even though you're not expected to do in-depth data validation, you still need to be concerned about the data quality for the information that you're using. The DQA process, especially the key inputs and steps, is very important for you to be aware of. In Module 5, you learned a lot about replicate samples, data flags, blanks, and things like that. The module did a really good job presenting this information, so I won't go into detail about that again, but I do want to outline the thinking process that you should go through when you're looking at and evaluating these data and deciding if you can use these data in your evaluation. So let me propose a scenario. Let's say you're conducting a data review for the GLC site, and you note that the replicate samples for one of the contaminants that you're interested in comes out to be unusually high, say 50% higher. EPA's guidance on DQA states that it quote, is the scientific and statistical evaluation of data to determine if environmental data are of the right type, quality, and quantity to support their intended use. And another quote, by using the DQA, you can answer two fundamental questions. One, can the decision or estimate be made with the desired confidence given the quality of the data set? And two, how well can the sampling design be expected to perform over a wide range of possible outcomes? End quote. It is important to note that per EPA, quote, DQA is built on a fundamental premise. Data quality as a concept is meaningful only when it relates to the intended use of the data. Data quality does not exist in a vacuum. One must know in what context a data set is to be used in order to evaluate a relevant yardstick for judging whether or not the data set is adequate, end quote. Thus, for our scenario, a 50% relative percent difference, or RPT, may be adequate or it may not, depending on the objectives of the study. The bottom line is that as a health assessor, you're not going to be doing an in-depth DQA of your data that you have coming in, but it is important that you look at what has been done. If the DQA has been performed, if the DQA has not been done, then you want to work with the data provider and get an assessment performed. You do not want to go through your entire PHA process, be writing a health consultation, developing fact sheets, and creating media messages, and then find out that the data you're using to make your public health determinations are weak or even wrong. You also need to perform some minimal evaluation of the DQA to see and understand the issues like how representative are your data and what were the purposes and objectives of your data collection. For this, you're going to have to consult the planning documents for the sampling. For example, for some air monitoring, the DQOs may be to try to evaluate fugitive emissions from facilities and not necessarily specifically to evaluate community exposure over a period of time. Understanding what the objectives of your study are is very important because everything that is covered in Module 5 about relative percent differences, blanks, flags, etc., are looked at through the lens of the data collector's objectives. If you are focusing on just evaluating if something is correct or some flag is problematic or not, and you're just looking at a number, you need some context of what that number is being used for. For instance, a 50% RPD could be problematic, but it would depend on the DQOs of the study. Again, in evaluating data quality, I cannot emphasize enough how important good planning is for those who are conducting an environmental sampling program. All environmental statistics books that I have read from a range of authors are filled with warnings about poor planning. Here is one author's insight that I particularly like. The bottom line is that if you have bad data in, you're going to get a bad PHA out of your process. And there's very little I can do as someone who practices statistics and data analysis to undo that reality. I do want to add that ATSDR typically relies on other agencies' sampling data. When available, planning documents from these entities should provide important perspective on sampling aspects, such as the environmental media and/or the biological materials to be sampled, the contaminants to be measured, and the proposed locations for individuals to sample. These planning documents should justify the various decisions made when implementing a sampling program. Data collection from different sources and for different purposes can be used in your evaluation, but you will need to review the available information to deem whether or not the data are appropriate and of sufficient quality for examining site-related exposures. If you're unsure about the quality of your data or next steps, ask the Associate Director for Science or ADS Group or your Technical Project Officer, TPO, or another experienced health assessor for input. What are some things you need to look for when you're evaluating sampling data? When you're looking at the Quality Assurance Plan, also called a QAP, or the sampling plan, what are some of the potential red flags that you need to be aware of? Well, first off, you will need to be aware of a lack of control samples, so things like lack of blanks or replicate samples. A lack of control samples means you won't know if just the sampling alone introduced contamination into your results, and you also won't know how precise the sampling program was. So if someone comes back and collects another sample in the same area and they get something different, you won't know if it's truly different or if it's just a product of a lot of noise in the sampling technique. Next is judgmental sampling. This is problematic because if you're going to apply any type of statistical analysis to the data in one way or another, the statistics assume some sort of randomization in your data collection. If you don't have some element of randomness in your data collection, all the statistical theory breaks down. If you calculate an upper confidence limit or UCL without a valid assumption of randomness, the UCL is not going to be valid. You need to remember that if you don't see some sort of randomized strategy in your sampling plan, that basically means you're going to be in a situation where you can't calculate a UCL no matter how many samples are collected. Also, you might have to consider what were the judgments that went into the sampling plan and decide, okay, which of these judgmental sample values out of the collection of specimens I'm going to take to be representative of the exposure point concentration. Now, I talked a little bit about judgment, but remember there are different types of sampling plans that do involve randomization and apply some judgment to them. There are things like stratified random sampling plans where people will concentrate more samples in a certain area, or there's different types of clusters or systematic sampling that can reflect judgment in locating a sample. If accounted for appropriately, you can calculate a UCL in your exposure point concentration. When we get to the EPC calculations, one of the questions you're going to be asking yourself is, okay, are these data generated in a judgmental sampling scheme, or are they generated in some sort of representative or random sampling plan? The other problem that can occur in sampling plans is collecting too few samples. Remember how we said that at least 8 discrete samples are the minimum number we want to have to calculate an upper confidence limit. This is a bare minimum under very idealized situations. Um, you're still going to have fundamentally very uncertain data. You might be able to get a rough approximation of what that uncertainty is. However, you're going to have wide confidence limits. The general rule is that if you're looking at a sampling plan, more samples will result in higher precision in your estimates of what the exposure point concentration is. Let me emphasize, the EPA guidance on DQOs state that anyone who is a data user can have a role to play in establishing DQOs. We, as a public health agency, can and I believe should be involved in the DQO processes before sampling occurs. Now let's take a more careful look at DQOs. The DQO process that is part of EPA's data quality system is laid out in EPA's document called Guidance on Systematic Planning Using the Data Quality Objective Process, or EPA QA G4. The DQO process involves many components. It's a planning tool, it's a thought process, and it's a collaboration model where we get input from both technical experts and the data users. The process helps develop answers to questions like, how precise do we need our estimates to be? It also defines how the data are going to be used and what are the consequences of incorrect decisions. The DQO process is a vital beginning model to use to understand and communicate what the purposes were in the study, what the questions were trying to be answered, what were the potential constraints, and what would be considered acceptable data or unacceptable data. I'm going to talk about 3 things I look for when I'm reviewing DQOs before I use the data. First, I want to understand the problem and the goals of the investigation. In other words, what was the question that they were trying to answer? Some plans are looking for hotspots to demonstrate that there has been a release of chemicals. Some studies are trying to answer if exposure is above a background. Others might be trying to look at how contaminant levels changed over space and time. Others might be trying to demonstrate if a given control technology is effective in controlling emissions. These different objectives may lead investigators to take samples in areas that are not necessarily representative of human exposure. Next, I look at whether the sampling plan used decision units or exposure units. Decision units are often used to support remediation decisions, while exposure units are derived to best estimate human exposure. Was there some rationale as to when, where, and how often the sampling was performed? For instance, like for the air monitoring locations that we looked at earlier with David, how did they decide to place the monitors? How did they decide when to perform the monitoring? How did they decide on the duration of the samples? Was modeling used to indicate a worst time frame or worst location to sample at? Were there operational cycles that needed to be captured in the monitoring? Likewise, for residential soil sampling, I would want to ask questions like, was there a standard sampling plan for the yard? Was the yard randomly sampled? Were only parts of the yard sampled? And what was the sample depth? And finally, how are errors going to be controlled, both in the laboratory and the physical sampling process? Were blanks, replicate sampling, and control samples used? How was sampling error controlled overall? Let's step through a DQO evaluation for the GLC treating facility and some questions you might try to answer by reviewing the DQOs from the documentation from our site. Remember, we're trying to estimate an exposure point concentration. However, samples can be collected for other reasons here. For instance, we have some data from one location at the GLC site where the drip pad was located. This sampling may have been conducted to evaluate if the drip pad was effective in preventing chemical releases. Um, you should think carefully about whether or not this is going to represent an entire exposure unit or not. Again, sometimes sampling is designed to cover certain decision units or just remediate for remediation purposes rather than exposure units for potentially exposed populations. Therefore, the area that the sampling is covering may or may not be congruent with human exposure. You need to also assess the sampling strategy and determine if judgmental sampling scheme was used in collecting these samples around the drip pad, or did they do some sort of randomized strategy to represent that entire area or part of that area. Remember, without a randomized sampling scheme, you cannot calculate a valid upper confidence limit of the mean. Sampling is designed to be representative of a certain area in space, called spatial boundaries, and time, called temporal boundaries. You should review the DQO documentation to see what these samples were trying to characterize. For instance, some sampling plans will focus on only part of the exposure unit, or just focus on a short-term exposure. You will have to evaluate whether you have representativeness of the entire exposure unit in your data. Depending on the data gap, you might need to ask for more data, or you might have to do some modeling. Knowing the temporal and spatial boundaries of the sampling can help determine if and how samples can be combined for calculating an EPC. For instance, sampling that is targeted at one part of our GLC site may not be combined with data that was targeted to another part to represent an overall EPC. Or, as another example, based on the toxicology of a contaminant, 15-minute samples cannot be directly combined with daily data in air sampling. In some cases, statistical methods can be used to combine the data, but it's necessary to account for these differences in spatial and temporal weights of the samples. You should also review your sample documentation to see how sample quality assurance and control was accomplished. So typically, this is going to be available in a QAP. A QAP should outline blanks, analytic spikes, and replicate samples and analysis. QA/QC samples identify if problems such as contamination or analytic imprecision exist in your samples. You should not combine QA/QC samples with analytical results when calculating exposure point concentration. If these samples identify a problem, then you should consult the appropriate section of ATSDR's FAGM. Now I'm going to talk a little bit about exploratory data analysis, or EDA for short. It's a critical topic that I will briefly touch on. Keep in mind some of the tools I will talk about are already built into tools like Microsoft Excel or ATSDR's EPC tool. So if you're taking data and you're manipulating them in a spreadsheet program like Microsoft Excel, it's not too hard to just bring up a pivot table or create box plots to get some basic understanding of what your data are telling you. EDA is meant to achieve at least a basic understanding of the data and its qualities. You don't have to report all these graphics that I'm showing you in the PHA process, but it's a really good idea to do some level of EDA before you start screening your data. Also, we do not recommend using the terms data cleaning or data wrangling. Although these terms are sometimes used, it can suggest that you are removing observations from your data or making your data somehow agree with your desires as an analyst. What in fact you're doing is you're reconciling your understanding of your data and making sure they are consistent with the DQOs and sampling plan, and working to make sure you understand and how to use the data appropriately. EDA does take time, and I recognize it's going to create some back and forth between you as an analyst and the data generator. You will need to generate summary statistics, tabulations, and graphics to help formulate questions to ask about your data. Some examples of what to look for as you go through the data include columns in the data set that seem incorrect or inconsistent, different and unknown flags, different media, and outliers that may suggest some potential sources of errors. And you do not want to be in a situation where you've had your units flipped and some of your data are in parts per million and some of your data are in parts per billion. Once you screen that against something, it looks very, very awful because you've used different units in your data. To avoid these kind of problems, you need to do some level of basic EDA. So what are some ways you can do an EDA? Well, the basic process you can go through is to take your data, do some tabulations to get some basic summary statistics, and then make some exploratory graphs. And inevitably, you're going to find things that you're going to have questions about. You will need to go back to your data generator, maybe a couple of times, to get those resolved. Again, as was mentioned before, the pH process is not a linear process, even though we're kind of presenting it like such. But oftentimes there's a lot of back and forth in the process. Cross tabulations are supported in Microsoft Excel. If you search the help bar for crosstabs, you can select different variables you want to do and summary statistics that you want to have. In the example table shown here in this slide, I'm looking at a chemical, an analytical method, prep method, matrix code, units, and a number. This slide is an example of the cross-tabulation output from an actual data set. And as you can see, there were multiple analytical methods and several different preparatory methods used. And there were different media and different units in the available data. We did some more querying of the data and discovered that there were blank samples and quality control samples introduced with the data. We did not want to screen those data, and we certainly did not want to do a health assessment based on a blank sample or a spike sample. This helped us identify that we should use this helped us identify the data that we should use in the PHA process, and just importantly, it helped us identify data we should not use. I'll tell you about an example from a real site. In a data set, there was a field that indicated whether the data were detected or not. By doing an EDA, we discovered that in some cases that field was blank. Initially, we thought this meant that the data was a detected value, but there was another field called lab flag that had the standard EPA QA flag of U contained in some cases, which means a non-detected value. So obviously there was a need to do some additional work on this. And it was just a simple thing of looking at the data and using a pivot table and realizing that there was two things indicating whether or not something was a detected value. The goal of examining the DQA, DQOs, and performing an EDA is to identify the data that you will use to screen your contaminants. Typically, you will use the maximum concentration in the media to conduct your initial screen to identify contaminants of concern. The DQO and EDA process will help you identify the data you will eventually use to calculate your EPC, which is used to estimate human exposures. Depending on your data, the EPC will either be a maximum concentration or a 95% UCL of the mean. You are going to do some level of statistical evaluation during this initial phase of the PHA process, and we will delve into this topic in the webinar on EPCs and exposure units, so be sure to look for that webinar. The bottom line is that good data going into the PHA process will strongly support good decisions in the end. To make sure of this, you will need to understand your data from its purpose and planning through your review of the DQO process to its quality and attributes through the EDA process. If you're unaware that you don't have good data by not doing a good EDA or not looking at the DQOs, you run the risk of making an inappropriate public health decision and having to go back and redo your analysis. And that concludes our presentation of this webinar on selection of sampling data. Thank you for attending.